Good evening and welcome to Seeing Eye to Eye on blackdoctor.org. I'm your host this evening, Shamika Rhymes. Let us know in the chat where you are watching from and be sure to share this with your network. And as always, if you have any questions at all tonight, drop it in the chat and we'll try to get to those as we go through our conversation tonight. So tonight we're tackling a very crucial aspect of health and well-being within our community, access to quality eye care delivery in the Black community. And our experts tonight, they'll be addressing everything from understanding the different types of eye specialists to insurance challenges and empowering you to advocate for yourself for better eye care. So I am so honored to be joined tonight by Dr. Joy Harewood. She's a leader in her field as the Chief Diversity Officer at the State University of New York College of Optometry, and she's an associate clinical professor. Welcome, Dr. Harewood.
Thank you. Glad to be here.
Thank you. And we also have Dr. Clifton Pay, the Clinical Medical Director of the American Eye Center, and he's bringing his extensive experience in ophthalmology to our conversation. So welcome.
Thank you.
So let's get started with this important conversation. So Dr. Harewood, I'm going to start with you. Can you talk about your experience delivering eye care in the Black community?
Absolutely. Thank you very much for the opportunity. I'm very looking forward to the conversation. So the majority of my career has actually been in New York City, the outer boroughs of New York City, mostly in Staten Island and the South Bronx. So I've had the opportunity to interact with and care for many different aspects and subsets of the Black community. It's important to note that the Black community is not monolithic. There are different people with different social strata, different levels of education. Where I've worked is primarily in underserved areas of the city. So I have primarily worked with those who have, trouble accessing care, those who have issues with insurance, those who have issues with paying for their medications. So many of those people have been within the Black community. If I can talk about the other side, the flip side of the coin is I've actually experienced, care as a patient too. One of my family members is visually impaired due to glaucoma. And so I've spent a lot of time in doctor's offices and retinal specialist offices, glaucoma specialist offices, advocating for and making sure that that person had care. So it's an interesting journey, and it's very depending on where you sit. But I've had a variety of experiences, and hopefully that will come out in this conversation.
Thank you. That's I love that unfortunately, you do have both sides of the coins, but thank you for being able to provide that perspective. Dr. Pay, can you talk about your experiences delivering eye care to the Black community?
Sure. Let me start out with kind of giving you a background as to who Clifton Pay is. I'm an ophthalmologist, and my medical training, my undergrad degree was in pharmacy from Howard University. I worked as a pharmacist for 2 years prior to going to medical school at the University of Buffalo, where I completed a 4 years medical school, in addition completing a medical asterisk internal medicine internship. From there, I went to the University of Michigan, the Kellogg Eye Center, which is ranked as one of the top 10 ophthalmology programs in the country. So I had an opportunity to perform and learn ophthalmology at the University of Michigan. And it gave me a very diverse background and expertise, having had the exposure to having been taught by some of the most profound lecturers and teachers in ophthalmology. From there, I taught at a medical school here in Norfolk, Virginia, Eastern Virginia Medical School for 4 years. And after doing that, I entered private practice and founded the American Eye Center. Currently, I have served as a chair of the National Medical Association, which, as you know, is committed to health care for marginalized communities. Our history goes back to the year 1895. So I've been a very key component player in terms of being a leadership role with defining health care for people who are without insurance. And at the same time, I've fortunately had the chance to serve as the chair of the ophthalmology section of the National Medical Association. And currently I'm in private practice, and I currently serve on the board of trustees of the Virginia Commonwealth University in order to get a much more global perspective in terms of the needs of healthcare. And eye health, obviously, is an area that I have specialized interest in. And so I think I bring a little bit of perspective from global, institutional, as well as a private practitioner.
Mhm. Thank you for that. Can you talk about how to know which eye doctor to see? Because I know that can be confusing sometimes. Do you see the optometrist? Do you see the ophthalmologist? And so, how do you know, Dr. Pei? How would I know that I need to come to an ophthalmologist?
Well, I think now ophthalmology and optometry, we're collaborative partners in the
Mhm.
delivery of healthcare systems at this point in time. And I think the training is basically with the ophthalmology community. Uh, as I highlighted my background in pharmacy, my background in medical school, and having completed a year of internal medicine. And I think that has an important component in terms of identifying the systemic association with disease and eye health. Also, training in a surgical environment where we learn to perform proper and current cutting edge surgeries when it came to glaucoma and cataract surgery. So I think from that perspective, that's where the value is brought. And I've not had Dr. Harewood obviously is an expert in her area, but I think it's a collaborative partnership that we can both collaborate and pool our resources and our expertise together to achieve and get optimal patient outcomes. And I think that's where we both fit in together. So that wall that used to exist is more transparent, and it's more of a collaborative approach with delivery of eye health care at this point in time.
Thank you.
Can I jump right in and agree with
Absolutely.
Dr. Pei?
Absolutely.
So when it comes to optometry versus ophthalmology, the way that I define it really simply is surgical versus non-surgical care. So if you need an eye surgery, cataract surgery, LASIK, or something like that that requires cutting into the eye and doing a surgical procedure, 100% you need to see an ophthalmologist. Also, depending on what state that you're in, there are some optometrists who do some minor procedures, but for the most part, when it comes to surgical care, you're going to see an ophthalmologist. When it comes to primary eye care, so those of you who wear contact lenses and glasses, which I know a lot of you do, um, both optometrists and ophthalmologists do provide that care. But optometrists, because there tend to be more of us and more widespread, tend to provide a lot of that primary eye care. When it comes to tertiary eye care, so if you have a more severe disease, severe issue, a lot of the time we will work collaboratively with our partners in ophthalmology to make sure that we take care of the patient holistically. The environments, primarily my work has been in academia, but also in hospital-based eye care. And so my whole career has been in collaborative models. So working with optometry, ophthalmology, as well as those in other professions, neurology, endocrinology, pediatrics, allergists, all of those different things in order to provide holistic care for the patients. So in eye care, you should hopefully after this conversation know where you should go.
Yeah. Well, how can people watching that are thinking about, okay, I do want to work some way in eye health. How can they become an optometrist or an ophthalmologist? Is there, a specific pathway that they should follow? Dr. Pei, I'll start with you.
Well, I think like anything, it's you identifying your interest in health delivery systems.
Mhm.
And I think, most of us who chose to choose a pathway toward health or physician development chose it because we have an altruistic model in mind, the delivery of healthcare. Because when you look at healthcare, it's an optimal state that you want to allow someone to arrive at in order to maximize their quality of life. And so, physician has to have that kind of scientific interest, scientific resources, and also interpersonal skills. They're very important as well. And I think
Mhm.
if you have those skill sets, one can identify a mentor or teacher and get advice in terms of how do I go about going along the pathway for becoming an ophthalmologist. For instance, I was very fortunate where I grew up. I had an older ophthalmologist who was a model for the community. And I had another family member who was a general surgeon. So they provided that kind of insight to me to give me that kind of direction. Not everybody has that kind of opportunity. And I think it's key for your people who are listening in the audience, if you have family members or interested parties, you have to identify a mentor, someone who's willing to give you that guidance in that direction. So again, 4 years of medical school, as I mentioned earlier, a year of internship. And again, you have to be able to score and compete and take qualifying examinations. For instance, it's called the National Board of Medical Examiners. And you have board certification, which I have both, board certification, as well as having completed the National Medical Examination. So these are important parameters that you have to search for. But again, the quality of being a physician is really predicated on your scientific inquiry, the inquisitiveness of your mind, and again, how dedicated you are to improving and wanting better health outcomes for our people in our community.
Absolutely. I see someone in the comments says passion is the key as well.
Oh, I think it's no question. I think you have to have a passion because it's not an easy path. I mean, you're going to spend a lot of nights studying when there's no one around, and you have to be prepared to prepare for examinations. And there's no one giving you any, how do you say, an easy ride, so to speak. So again, it's commitment, but the rewards personally are phenomenal, I think. And so again, I think it's very critical to find and adopt, create your own board of directors who provide you that kind of direction. So that's my suggestion. And then see if this is really what you want.
I like that. I like that. Dr. Harewood, how about you?
Absolutely. I know that everybody knows that it starts early, but it really does start early in terms of having that interest. And as Dr. Pay said, perhaps having a mentor, having somebody that you look up to, but you have to identify in high school that you're interested in something in the sciences, or at least have an idea of it. And to take the optometric pathway, you need to do a 4-year undergraduate degree using, making sure that you get certain prerequisites, so certain courses that are necessary to apply to optometry school. That is your chemistry, that is your biology, that's your microbiology, a variety of different coursework. Once you complete that coursework, you send through your application and you apply to a 4-year optometry, doctorate of optometry program. There are 24 optometry schools in the US, 2 in Canada, and so you would apply to one of those schools. After completing those 4 years, you can go right out into practice, or like myself, you can pursue further training. So for myself, I did a 1-year residency to specialize in ocular disease. Along the way, as Dr. Pay said, there are qualifying examinations. We have 3-part board examinations. You can also become a fellow of the Academy of Optometry, which is another type of certification. And then you can become a diplomate in optometry in the American Board of Optometry. So there are a variety of qualifications, but if you have the passion to do it and the interest, or know somebody who has the interest, then it's something that definitely reaps those rewards. In terms of optometry, people often like it for a couple of different reasons. One, it's so uplifting to have someone come into your office and be unable to see, oh, I have a problem, click a few dials, and they're able to see 20/20. There's something really nice about that. It also can offer you a really good work-life balance. I think that's what a lot of people think about when they come to optometry. I don't know that I've met a lot of sad optometrists or really sad ophthalmologists either. So it's something I'm very passionate about. So if you know somebody who has an interest in sciences and healthcare delivery, I would strongly say, reach out to one of us, consider one of us a contact or something like that, and just go for it, or at least investigate it.
Yeah, now I'm thinking I need to talk to you guys for another podcast, but we'll get back to that later because this is great. So what are the steps that patients should take to find an ophthalmologist or an optometrist for their specific condition? Because, a lot of times now we turn to social media or even Chat GPT when we're trying to find things these days. So Dr. Pay, we'll start with you. What steps should someone take to find an ophthalmologist for their specific condition?
Well, there are several investigative efforts that you have to do to try to find an ophthalmologist. And again, oftentimes people will say, my mother went to this particular ophthalmologist, or I had a friend, or you meet somebody on the bus. And I think, there are so many casual acquaintances that you can have that recommend an ophthalmologist. I think the key parameters that you want to look for, and again, social media has become very prominent as a place. There are even grading programs, health grades, and that allow you to kind of look at a physician in terms of their years of experience, their expertise, their core expertise, and also what are things like with the waiting times. Okay, and maybe that's not that critical, but not everybody wants to wait for an extended period of time in a physician's office. So you look at, is there compassion? Uh, what's the response of the office staff? Because you're not just engaging the physician in and of itself, you're actually engaging the entire clinical staff. And it's the clinical staff that has to show availability on hours and off hours. What physician has in place for me or for my family member after hours? And these are the kind of questions that you should be asking. Your training, your board certification. Are you a fellow of the American Academy of Ophthalmology? Are you a fellow of the American College of Surgeons? What are your availability? How accessible are you? What is the time lag between making an appointment and being seen? And I've never had that philosophy that a person should wait months and months and years to be seen. We live in a different kind of world, a different kind of economy now. And I think we have responsibility to show that we're responsive, that we're on time. That's part of the delivery system. So those kind of evaluative tools you have to look at. And again, of course, still want to look to your family members because they can be a source of information. Members in your congregation, sorority or fraternity, or your Elks or your Masons, those are not bad avenues, and I still encourage that. So I'm looking at a panoramic 360-degree situation. Then when you visit with that person, just go by maybe before you go to see that physician or that ophthalmologist. Is this the kind of office that I would feel comfortable with? How polite, how receptive are they? Do they seem interested in me? Do they primarily ask me for my copay before I'm actually seen? So these are the kind of things I think you have to feel comfortable with the provider of your care. Is this the kind of person that I can trust, that I can hold in confidence? And God forbid, if things go awry or things don't go the way we expect it to go, is this the kind of person who would be patient with me and bring resolution to an unforeseen outcome? So these are all the kind of parameters I think that's important as well, too. And nothing wrong with bringing a family member. I think bring a family member to that encounter and have them make that assessment.
I like that. How about you, Dr. Harewood?
So I'm going to take my optometrist hat off and put
Okay.
my patient and advocate hat on and tell you specifically what I'm looking for. If, I'm going with a family member or if I'm looking for any type of provider. First, I'm going to look at obviously qualifications and people in my area, especially if you have some sort of acute eye condition that may require follow-up care. You want to be able to make sure that you can make it to that office. So I'm thinking, okay, how can I access that office and what's in my general proximity? After that, I'm looking at, the credentials and I'm looking at my level of comfort, as Dr. Pay said, with that eye care, that eye doctor. I want to make sure that they're accessible. If I use, if I have mobility issues, am I going to be able to walk into the office easily? Am I going to be able to get there easily? I'm looking at that. And then I'm definitely looking at what is my level of comfort. If I ask a question, am I going to get an answer? How quickly can I get that answer? So if you may not have time to visit the office before you actually need the care, when you're in the office, let's just say you've done your research and you've made your choice, maybe you've had somebody recommend someone and you're in the office, how comfortable do you feel having that back and forth conversation with that doctor? Because that is of the utmost importance. It's important, definitely, the credentials and everything like that. And I would say specifically for surgical care, the number of surgeries that a doctor has done has a huge impact and actually has a very big impact on whether or not they are qualified in their ability to actually do the procedure that you need. So it's important. But if you can't talk to and you can't ask your questions and you can't feel comfortable in that person's care because you're coming in often in a vulnerable position, then that may not be the doctor for you. So
Mhm.
hopefully that gives you a taste of what I would look at when I'm looking
Yeah.
for an eye care provider.
Yeah. I also look at reviews online, Google reviews to see because I need to know
I'm
what
not
other
gonna lie.
patients went through.
I do, I have used ZocDoc, other platforms to look, but you also have to make your own assessment
Right.
because a lot of the time when people are reviewing, the people who write a review often have had some sort of very good or very bad experience. People
That's
in the
true.
middle often don't submit a review. I can tell you myself, if I've
Yeah.
had a very good experience or a bad experience, I'll submit a review. So,
Mhm.
you want to make sure that you're taking that with a grain of salt.
How can people find out how many surgeries someone has done? Is that online somewhere?
No, I don't think it's online.
Okay.
I think it's the kind of opportunity that you get to ask that person, while
Okay.
you're there. And you want someone who's candid. And again, kind of reemphasize what Dr. Harewood and I were both kind of talking about.
Mhm.
How do you manage a surgical outcome that didn't quite go the way you expect for it to go?
Right.
Because, and you never want to tell a patient, it's an easy operation. I've done 10,000 of these and got the perfect hands. I have no tremor. I think you have to be really candid and honest with patients and take the time with the use of models and teaching tools to explain to them, this is this and this is that. And what happens if there's a complication? Because again, it's not an issue in terms of how you perform the procedure, it's the outcome and it's the kind of judgment that you do if things don't go quite well. So I think those are very important. So of course, you should ask the search, how many of these have you done? How
Mhm.
comfortable are you with my case? Is my surgical situation, is it unusual that I should expect a not so optimal outcome? And I think when you hear people on honesty, and what you don't want is a 15-minute visit, because when you're seeing a surgeon, you want to make sure that your questions have been answered and that the surgeon has offered to allow your family member or anyone else who's responsible party or partner to be a participant in that dialogue. So again, I think that's very critical: is comfort level, skill set, and judgment. And those are valuable tools that we have to kind of employ to make those kinds of decisions when you commit your body to a invasive procedure.
And I will add a
Absolutely.
caveat to that. Sometimes those questions may not be able to be answered in the moment
Mhm.
because sometimes schedules, especially those who are highly in demand, they may not be able to answer you immediately or
Mhm.
at that particular visit, but giving you an avenue to get that answer relatively quickly is good. Whether that
Mhm.
is through a proxy or whether that's through, being able to message or something like that. If you can get that answer, that is important, whether or not it happens immediately in that moment.
Okay. I do want to remind everyone in the chat. I see you guys. If you do have any questions, please drop it in the chat. Let's talk insurance. Dr. Harewood, what are the biggest challenges in reference to the uninsured, underinsured, and insured in the Black community?
I mean, these are huge challenges because your insurance is going to dictate who you can see, unless you want to come out of pocket. And many of the procedures or many of the things that you're coming to visit for, if you're paying out of pocket, it's incredibly expensive. And I would say prohibitively expensive for you to see care outside of your insurance. So, because your insurance is going to dictate, sometimes that can narrow the pool. It also means that sometimes there's certain things that are not covered. Not every insurance is going to, for example, cover glasses unless you have specific insurance for glasses. If you
Mhm.
get glasses, it may not cover contact lenses or some other thing that you may have. Generally, if you are under 21 or a child, there are certain things in place that allow you to access care, but it can narrow your scope and your ability to see an eye doctor.
Mhm.
I will say this, depending on the state that you're in, there can be avenues if you're underinsured or uninsured. From my own experience, I worked in hospital-based care, and in the emergency room, regardless of whether or not you could pay, we're going to see you for your particular eye condition. I'm not saying that's where you should flood or go to, but that is an avenue for people who have emergent urgent eye conditions that we've definitely been able to work out a sliding scale. The hospital that I work at in the South Bronx has a sliding scale. So if you do not have insurance, we can work with you to try to make sure that you can get the care that you need at a lower cost. So I think just asking those questions, being really upfront and honest about what your insurance situation is, will make a wealth of difference in us being able to offer you solutions that can hopefully mean that you get the care that you need in a timely fashion.
Okay. Dr. Pei, how about you? What would you say the biggest challenges are?
Well, I think Dr. Harewood has hit on a critical point. One, we've had a problem with the uninsured in this country for some time because of the value proposition that we have in terms of what and how important is healthcare. And it's a debate that's probably going to continue for some time. There are some people who argue that perhaps healthcare really is a constitutional right, as opposed to healthcare being simply an elective option or privilege. So these are the kind of issues that have to be resolved because, again, as long as we have an employer-based healthcare system in which between the pharmacy benefit managers or the surgical coordinators for these health insurance enterprises are in a position to determine which medication you can receive, which panel of doctors have agreed to see people under our insurance plan, we've eliminated freedom of choice. And I think choice is an important thing because we all should have choices and not necessarily feel that we're being directed toward a certain managed care product or insurance product that restricts the medication that we can get, restricts the care we can receive, or even define how many visits you can have. And then there's an issue comes up with, will my physician get paid? I know that seems like kind of a thing that we're not talking about.
Yeah.
But so this issue of the uninsured is a issue that really commands a lot of attention on the part of your audience and all of us as healthcare providers. We've really got to stand in the forefront of advocates for our patients and pushing expanded insurance coverage. Because if we have a healthy population, the entire society benefits from a healthy population. When we invest in ourselves, we create a much more healthier outcome and we create a much more sound, responsible society with greater longevity. I mean, the data shows that with people who have cataract surgery, with retrospective meaning back checks have shown that the people who have cataract surgery have a lower risk of having a hip fracture. Can you imagine that? A fracture of the hip because of depth perception issues. If you have cataract surgery.
Uh-oh, we lost you. Hopefully he comes back. Okay, well, we'll just keep going. But can you, Dr. Harewood, could you speak to Medicaid coverage options?
Absolutely. I would say for Medicaid, there is what's called an early treatment and diagnosis program for those under 21. And what that means is there's certain things that, as long as you're diagnosed before, when you're younger, actually help you have a better life outcomes, product, and all those different things. Eye care is included in that program. So what that means is if you have Medicaid for the most part, and it varies state by state. So let me say it's not across the board, varying state by state. If you have Medicaid, a lot of the time, if you're under 21, you may be eligible for an eye exam. You may be eligible for eyeglasses for the most part, and you may even be eligible for a replacement of those glasses. Those of you out there who are parents who, have kids who have glasses and they lose their glasses, often you can get that replacement if you have Medicaid. So for people of that age group, we definitely do have coverage. When it comes to people who fall outside of that age range, that's when things get a little bit more tricky in terms of being able to get glasses, being able to get visual aids and things like that. But as I said before, we can always try to work with people. And if in our private practice or our personal office, we're unable to see you because of an insurance issue, I always think that there's a duty to try to create an avenue or try to make sure that you're able to be seen elsewhere. That's something that I would do all the time when I worked, in private practice. If I can't see you or if I'm unable to take care of your needs, let me make sure that there's an avenue where your needs can be taken care of.
Absolutely. Oh, here we go. I think Dr. Pays, there you are.
Yeah, I think it was a gremlin.
That's okay. Can you, I know we talked a little bit about, while you were gone, about Medicaid coverage options, but since you're back, can you talk about Medicare coverage options?
Well, Medicare and Medicaid are two different kinds of insurance products. Medicare is for the disabled or people over who are disabled or people over the age of retirement, 65 or 62 years of age. The program was established in 1965. President Johnson created the Medicare program. And by the way, not to extend any laurels, but the only national medical organization that supported President Johnson's Medicare Act was the National Medical Association. African American physicians were behind it. No other organized medical body gave support to the Medicare expansion, or creation of Medicare. And Medicare has taken different turns. It was a very broad program when it was created. Now they're beginning to create what they call a Medicare Advantage program. And the Medicare Advantage program is an incentive by private profit companies to manage Medicare recipients by providing them restricted panel of physicians and a level of care. But they make a lot of promises in terms of, this, you can have this, you can have glasses for free, you can have this. So I think we're in a different world now in terms of people being incentivized to go into the more private, for-profit Medicare projects. When I say for-profit, not for the patient, but for the people who own and manage the Medicare Advantage products. So I like to think about those as kind of a HMO, a Medicare HMO. So it's kind of changed the landscape a lot. And again, I think Dr. Harewood was so appropriate with her comment about we have to continue to remain as advocates for our patients in different avenues in order to ensure accessibility as healthcare providers.
Absolutely. Well, speaking of advocacy, how can patients be a better advocate for themselves so that they can have better access to care? Dr. Harewood, I'll start with you.
Absolutely. I think being informed is one of the main things. So whether that information comes from your eye doctor or that information comes from reputable websites that can give you the information that you need about the eye condition that you have. So making sure that when you enter a situation where you're able to ask an expert, you have the question, you even know the questions to ask. I think sometimes, you're sitting in that office, you may have an eye condition, you're concerned about it, but you don't even know what questions to ask. So when, the doctor turns to you and says, "What questions do you have for me?" Sometimes you're completely taken aback. So if that's the case, then, take a moment, take a beat, whether you go and come back and ask your questions then that would make sure that you get the answers that you need. I'll also say there are certain programs that actually teach you to advocate for yourself in eye care. I know that Prevent Blindness has an aspect program where they actually train patients to advocate for themselves. I've definitely spoken with and really been impressed with some graduates of that program who may have had a child who's visually impaired and been able to advocate for them on a national level, on a higher level, because they went through that type of training. I provided some resources for this program, and I believe I provided a link to that.
Okay.
I will say some of the best advocates, doctors are great advocates, but some of the best advocates when it comes to actually changing and moving the needle, when it comes to access to care, insurance, are patients. Their stories, their individual stories and narratives, that is what people listen to. Often that is what your elected officials are going to listen to. So not only can you be a good advocate for yourself in the exam chair, you can also be an excellent advocate for others on a grander scale.
I do believe we did. I think it was maybe 3 months ago. I can't remember exactly, but we did have some visually impaired patients come on and talk about that particular program that you mentioned. And I think one of the doctors also talked about that as well. So we'll make sure to put that link in the comments so that everyone can check that out. Dr. Pei, how about you? How can people be good advocates for themselves for
Well,
better
well,
trust
I
the care?
think, I think what Dr. Harewood alluded to is so critical
Yeah.
because we're asking the patient now to take complete charge of your care. You have to
Mhm.
become the agent change yourself in terms of the steps that you take on a personal level with you and your physician, and even on a larger level, as part of social community that looks at the kinds of accessibility issues. Because again, when your voice is spoken, I tell patients, for instance, there are certain medications that I want to prescribe for my patient, and that insurance coverage is not there. I will tell the patient, call your insurance company and explain to them why you should have this medication. And you know what? A lot of times, most times, they will listen to the patient. So the physician or the optometrist, those of us who are in the delivery of these kind of services, they will probably pay, how do you say it? I'm trying to be polite. We have more challenges to encounter.
Uh-huh.
Whereas when that patient goes to that same insurance company and says, my doctor says I should have this, you'd be really surprised at how quick that response is. They're less because that's the beneficiary. You are the beneficiary.
Mhm.
You own the product. The company works for your self-interest. You and the doctor are on the same team. You're working for the same outcome. And so you've got to take off the hat of becoming a unempowered patient to now putting on the hat of becoming an empowered patient. So you have to look at those resources and take on those challenges. And you don't have to be hostile in that situation. You know, I know you may feel that you kind of feel a little bit perturbed, but your advocacy with that company can make a difference. And I've seen
Mhm.
it done, and I'm sure Dr. Harewood has seen it done. So I encourage your audience to really kind of don't see themselves as a passenger, but see themselves as a driver in this whole process.
Mhm. So let's talk a little bit about research. Dr. Pei, what research is being done to support interventions to improve eye health for communities of color?
Well, I think population-based healthcare is looking at it more and more. We use a term that you'll probably hear used a lot called social determinants of healthcare, social determinants of care, which we identify other risk factors. It's so easy to talk about risk factors in terms of genetics. You look and say, well, these many Black people, but now we're looking at social impacts, social factors that come to bear when it comes to identifying things that impose risk and increase the opportunity for someone having a certain disease. So there's a lot of preventive efforts now being placed in terms of genetic modifiers, looking at genetics, finding common genes that carry certain kinds of traits or certain diseases, identifying certain what we call chromosomes, identifying again certain communities that have a certain prevalence of certain things that are occurring more commonly. So I think there's a lot of efforts now because we know that preventive care is really the best care.
Mhm.
If we can minimize and not have to get involved at the end stage or the late stage of a disease, we're all going to have a better outcome. And we believe me, we all feel much better about that rather than having a person coming to us at a very advanced stage. And then we have to present a different kind of dialogue and different that kind of discussion. So again, I mean, this is the new position. Access to your physician, your optometrist, your ophthalmologist, and again, recognize that we have to all take notice of all the new treatments that are becoming available. And I'm sure
Mhm.
artificial intelligence is going to play a bigger role with giving all of us more information in terms of the kind of steps that we all have to take. So I think we're heading in a great direction, but even with AI, we'll still need some guidance and some support from your eye
Mhm.
care provider.
Absolutely. What about you, Dr. Harewood?
There is a, a lot of research out there and a lot of great research being produced to understand healthcare disparities. And unfortunately, in this country, a lot of those disparities affect the Black community. I had the opportunity
Mhm.
to be part of a white paper that was looking specifically, it was published in the American Academy of Ophthalmology Journal. A group of us were looking at eye care disparities to be able to identify what does that look like in the US? what are the targets? What should we be doing? What, as Dr. Pei was saying, what social determinants of health are impacting people's ability to access care? And how does that interplay with patient health outcomes? There's a lot when it comes to doing studies of that. There also are a lot of studies on specific diseases that are coming out, glaucoma being one of them, and that disproportionately affects the Black community. And that research is to understand what are the underlying causes and conditions that make somebody predisposed to that. Even something like nearsightedness, which is called myopia, there is an increasing amount of research to understand how are people becoming nearsighted. Because nearsightedness, there are ways that we can try to interrupt nearsightedness. Now, most people, when they think about, oh yeah, I'm nearsighted, I just put a pair of glasses on, that definitely is helpful. But there are those who don't have glasses, and there are also those whose nearsightedness is so severe that they couldn't get out of their house if there was a fire at night without their glasses. So there's a lot of really exciting research in eye care delivery systems and specific eye issues, as well as in those disparities. And with that data, that translates to eye doctors like us being able to provide better care, more timely care, and specific care targeted to different communities like the Black community, so that we don't get to those stages that Dr. Pei was talking about.
Well, we were talking a minute ago about how important it is to for patients to share their stories. Can either of you share a success story about connecting to eye care? Dr. Pei?
Well, I can tell you, I've had a lot of interesting encounters with patients in terms of, I've often thought about writing a book just to kind of highlight some of the interesting. I never forget, I had a patient once who came to me, her daughter brought her to me because her children, the grandchildren, was telling their mother that our grandmother, we help her drive. And they said, well, she said, well, what do you mean you help grandma drive? I said, well, she drives, but we help her drive. I said, what happens? She says, well, when the light turns red, we'll tell her she can move. And when light turns red, she can stop. When the light turns green, she can go. And then we tell her to stay direct on one side of the road. Well, it turned out, unbeknownst to the daughter, this grandmother had cataracts in both eyes. And she was too embarrassed to tell her daughter because she wanted to make sure that her daughter was able to go to work and the grandchildren were provided for. And so once we got her seeing better, we allowed her to get back on the road and to drive herself and not have to have assistance from the passengers in the vehicle. So I've had that. I've had patients from different parts of the world, from Africa, from Sudan, who I have enjoyed taking care of, different cultural people, different backgrounds, patients from Europe that I've had the opportunity to perform surgery on. And it really makes you feel good when people ask you, can you perform my surgery? I've had people from different parts of the United States come in for me to perform surgery. And it really makes you feel that what you decided to become in life is worth it. And you say to yourself, this was an opportunity that was created for me, and I want to make the best of it and provide the optimal care. So those are just a few of the success stories that I've had a chance to participate in. And I just can't tell you how much good I feel. I feel it's a gift that we've been given as providers of eye health. It's often been said that the eye is the window to the soul. And it's not only the window to the soul, but it's the window to the rest of the body. So early on in my practice, we did visual field testing and we diagnosed someone with multiple sclerosis. And it bothered me that I made that diagnosis, and I've diagnosed him with a brain tumor. And I felt so bad. But the patient was like, we're so glad that you did that because we can better prepare our life and better prepare our options. So these are the kind of success stories that make you feel going to work every day is a God gift, that you're allowed to have that kind of interface. So again, that's just my own experience, and I wouldn't trade it for nothing.
Write the book. Write the book, please. Dr. Harewood, how about you?
No, I've definitely had a few, and I was thinking of one. I work in an academic medical center where we actually have a lot of people who have hereditary retinal conditions, so diseases that come from their family of the eyes. So I was planning on talking about one of those, but I see a question in the chat that I'm going to loop into a story instead, and hopefully will answer the
Okay.
question.
Okay.
So I had a patient when I was working at a hospital in Staten Island who I had been treating for a few years. He would come in with his son, 20/20 vision, very normal routine patient. He came in one year, and instead of being his regular 20/20, his vision had suddenly reduced in both eyes. He didn't notice anything. He didn't notice any symptoms, but I noticed that his vision was worse. And the one thing I always tell myself, my North Star is there has to be a reason why somebody is not 20/20. I must find a reason. And if I can't find that reason, maybe somebody else has to find that reason, but there has to be one. So in any case, he came and he's not 20/20. And I said to myself, this doesn't make sense. So as Dr. Pei was saying, I did a visual field, which is a test of your peripheral and side vision. And he had a very, very characteristic side vision defect that immediately made me think this person has a brain tumor, actually a pituitary adenoma, which was asked about in the chat. Because I worked at a hospital, I walked the man and his son down to the emergency room where he was able to get in to see our neurosurgical team. And within the next 2 days, they had removed his pituitary adenoma. When I saw him back a few weeks later, his vision gradually improved and his side vision gradually improved. So it's stories like that where you think to yourself, taking that extra step for that patient, thinking to yourself, I'm not going to wait to have this patient come back and figure out what's going on. I have a relationship with this patient. I'm going to understand why their vision is not what it is. Those stories really stick with you when you go the extra mile. So to answer that question in the chat, the optic nerves are affected by pituitary macroadenomas because the tumor itself can press on very important issues and very important areas of the visual system and slowly cause some of the nerves to die. And that can reduce your side vision and eventually your central vision. So if that's something that you have or you know somebody who has it, it's something that should be monitored and addressed if it needs to.
Thank you. Thank you. Oh, it seems like time has gone. This has been such a great conversation. Before you both, what are your hopes for the future of access to eye care in the Black community? And is there one other thing that you want to leave with the audience that's watching today? Dr. Pei.
Well, I think using forums like this is really beneficial because it gives us an opportunity to take off our white coats and have this kind of consensus discussion with your audience and with you as a moderator. So I think these platforms provide us an opportunity to kind of hear what do the people want? What are their concerns? What do we have to do to be able to expand our services and respond to their needs? So I think in terms of the hopes, as long as we continue to have these kind of educational forums in which we provide this kind of insight, because as we said earlier from both of us, when you're in the office environment, sometimes you can't get everything in. And if you have another opportunity to do that, these opportunities are so welcome. And the fact that this entity exists like this for us to explain things in a relaxed environment and allow the people in the audience to put their information into the chat. And other questions they may have may come up at a later time. And I'm sure we both will be available for that. So I think the future of access to eye care is going to be what we want it to be. It's not looking at a top-down version. It's what do we have to create architecturally wise and create the right platform from the beginning to be able to provide our patients the optimal in healthcare. Do you know, when you look at longevity, life statistics, if you become blind or disabled, visually disabled, your life expectancy unfortunately declines. And again, it's generally associated with other risk factors. For instance, another thing we often don't talk about, look at obstructive airway disease, people who have obstructive airway disease. Now we found that that's a component in terms of making the risk of glaucoma much more problematic. So as we show more linkage with systemic disease, that's why we ask questions when the patients come in. What is your hemoglobin A1C? Do you have problems with sleep disorders? Do you have problem with any arthritic condition? All these systemic things that people would say, well, why are they asking that kind of question? Just the eye doctor. Why would they want to know all those things? And why they want to know what kind of medicines I'm on? These are my medicines. But we tell every person, bring the medication with you, because all of that is part of the diagnostic tool that we use to evaluate. So again, I think these are the kind of parameters that we have to look at. Increasing platforms, making the patient feel that we are a partner in your healthcare.
Mhm.
And feel free to tell us all these things. And there's no such thing as too confidential. We need to know things, because if we don't know things, then we can't help you if you decide to hold back information.
Thank you for answering that question. I had always wondered why you needed to know all the things at the eye doctor. So thank you for that, because I was one of those wondering that. Even though I tell them, I was still wondering. Thank you for that, Dr. Pay.
You're welcome.
Dr. Harewood, how about you? What
So I
what
will
do you
say
want? I'm sorry, go ahead.
I was going to say two things that I'm very hopeful for when it comes to the future. One is technology. So things like artificial intelligence, things like telemedicine, ways that will hopefully increase access to care for those who are in rural areas, those who have mobility issues, those who are not able to access eye care for a variety of different reasons. I think that there are some solutions in those technologies. Obviously, coming in to see somebody face to face, I think, is the gold standard. But if you don't have the ability to be seen, having some of these other technologies and other ways to get care, I'm very hopeful for that. I also, as I said, I work in academia. I teach students and I teach residents in optometry, and they make me hopeful for a variety of different reasons. One is their interest in understanding kind of the root causes of why certain communities have, health disparities.
Mhm.
They're interested in that. They're asking those questions. They are inquisitive, intelligent. I think the future is bright. And those are the future leaders in eye care. Those are the people who you're going to be going to. So I feel fortunate to have the opportunity to teach them. And I think if they are what I've seen from my small subset of students and residents, I think the future is bright for the Black community and all communities when it comes to eye care, marrying that technology, research, as well as these new doctors of the future.
Thank you. I want to thank you both, because this conversation was so good. I swear we need a part two, but this conversation was so good, so enlightening. I want to, thank everyone in the chat for their comments and questions as well. For more information on eye health, make sure you head over to blackdoctor.org for articles and resources. And the link that Dr. Harewood mentioned earlier, I'll put it in the chat after this. And I wanted to ask real quick, you both mentioned that you're open if those in the chat or those that may watch later have questions. How can they reach out to you?
Well, I can be reached. I'm listed, so it's not a private number. And my Clifton L. Pay, MD, or American Eye Center is listed.
Okay.
We have a website as well, American Eye Center website. So we can reach there. And before I go, can I just make one other comment I forgot to make comment of? And this is a personal thing that I think. I think one issue going forward is the issue of medical education, optometric education, because the cost for getting an education to become a healthcare or eye care provider has almost become prohibitive in the sense of the tuition cost, the medical school, optometry school cost. I think we've got to figure out a better way of how does a society that wants to advance its own self-interest, how does it find an affordable tuition for people who are scientifically and desirous of this kind of career, like Dr. Harewood and I both represent. So I just want to get that point out. And again, that's going to involve a whole lot of discussion. We've got to really look at the cost of a medical education. No young person should come through optometry or ophthalmology with the debt structure of what it would cost to own a house. And that sounds kind of fraud, kind of unbelievable. But these are real, genuine, legitimate issues that we have to, start looking at. If we want to preserve the quality of people who are entering the profession. So I'm sorry to get that one off. I had to
No,
kind
no, that is a great point. That's a great point. Thank you for bringing that up, because that just gave me an idea for maybe for another show we dive into that, because that seems like a whole show in itself, because that's yeah, I never thought about that. So thank you for bringing that up. Dr. Harewood, how can people reach out to you?
The best way to reach me is really my email, which I'm happy to provide. It's my professional email, which is jharewood, JHAREWOOD, at suny-opt.edu. And I'm pretty quick on it. Not super, it might not be tomorrow, but you'll hear from me.
All right. Thank you both again for joining us here at blackdoctor.org. Everyone have a wonderful evening. Thank you.
and thank you very much too.
Thank you.
I don't know if it's stopped. It hasn't stopped yet. Hold on. I think we might just have to leave the studio.